It's a question for Mr. Dubé. You mentioned people are getting very tired of this pandemic and perhaps feeling like there is no end in sight. I know we're only getting 6,300 doses of Paxlovid this month, but by March that number will be 19,000. And based on the statistics that Ines was saying, if you're giving 19 doses and it's preventing one hospitalization, that's potentially 1,000 fewer hospitalizations per month. Is this drug the light at the end of the tunnel that we're talking about?
Well, for long term, I think that's the right thing. I think the numbers that have been quoted this morning are based on the study for a certain population. And that's exactly what Dr. O'Patterney. So I wouldn't take the number 19 as being, the only number to remember. But I'll give you one number that I think is important. If we make the right choices, as recommended by l'INES and by all the experts, we had in the last 28 days 6,000 persons that entered the hospital for various reasons. And those are the 3,000 that are still in hospital for COVID reason. Okay. So I think if we make the good selection, even though we only have 6,000 treatment, we could remove a good portion of those hospitalization. Is that the solution short term? That's part of the solution. But there is one solution short term. One, vaccination. And vaccination, as I mentioned in French earlier, right now we vaccinate roughly 1% third dose of the population. This last weekend we had just a bit under 100,000 vaccination, 80,000, 78,000 Saturday and Sunday. But we are able to do 125. 125 would be that we would vaccinate about 2% of the population every day. And that's what we should be aiming at doing. Quebecers have done it in the last year. Twice, first dose, second dose. Let's do the same thing. And while those antiviral, whether they're from Pfizer or any other manufacturer, they will be the solution long term. But right now, the short term solution is vaccination.
And just further to that, I know, you say that Quebecers are having a hard time. We're feeling that. What do you say to those who feel that this pandemic will never end and who just feel like giving up on following the health measures?
Well, we're not saying it will never end. We've seen the other waves; they come up to an end. I think in the previous wave we didn't even have the vaccination. Now we have the vaccination. We see that as public health has said, this Omicron is different, and we're adjusting. The manufacturing are adjusting their vaccine to be able to be closer to the need of Omicron. So this wave will end, but I think we're preparing ourselves to be better responsive when we have this sort of thing. But this wave also will end. So we should not get discouraged. We should say, what is it in our power to do right now? And I'm repeating myself. I'm boring. I know. I accept that. I am boring. But please go and get your vaccine as quickly as possible.